Hey, welcome to my office. Dr. Chuck Berg, Rivervale Chiropractic Center. Right now it's, where are we? I think it's May 3rd, and we're entering spring. And when I hear the word spring, it automatically makes me think of people getting a lot more active than we were during the winter the winter months. What I want to talk about are some of the common injuries that we tend to see in our office, common to this time of the year. A lot of people like to play tennis, racquetball, movements where they're using their hands and their arms. And how many of you have heard of the word a tennis elbow? A tennis elbow is not something that we have to get as a result of playing tennis. The fancy word is lateral epicondylitis. Not important to remember that. But what I want to share is the essence of the injury itself. What's happening? When I talk about tennis elbows, I don't know if the picture can capture this, but I'm moving my hand a lot. It's what we call a repetitive stress injury. Now, just like our foot, I have a plastic model of the foot, and what you see here is a tendon. We call that the plantar tendon. And many people wind up with something very similar at the bottom of their heel. It's called a heel spur or tendonitis of this bone at the base. So whether it be the tennis elbow or this particular condition of the tendonitis at the bottom of the foot or a heel spur, it's the same mechanism of injury. So let me explain. As a result of constant running and pounding to our feet, a tendon can pull on a bone. So at the bottom of our foot, we develop an inflammatory condition, and at our elbow, we get an inflammatory condition as a result of a muscle being used over and over again. So that's what's happening. Now the question you may ask is, what do we do? How can we help it? Well, any inflammation, by the sheer nature of the word, it's inflamed. You can see it's reddened. What we want to do is put ice. Obviously at the bottom of our feet, the foot is very, very challenging because we wind up bearing our full weight on it. So we want to get ice at the base of the foot. We also want to work and stretch out the tendon. With the arm, we do a lot of deep tissue work, whether it be with my hand or whether we have a roller and we put the person through a range of motion with a great deal of pressure. It helps to reduce the inflammation onto that muscle and onto that tendon. Obviously, folks, it's a good idea to get away from the activity, give it a good solid week of rest. Ice being very, very important. In the office we can use ultrasound and some other types of modalities to help the inflammation. And of course with feet, many of you who may be aware of, there's something called an orthotic. It's something that we can create and make custom for you and place in your shoe so that every single day that you are bearing weight, you have the proper support so that that foot does not wind up pronating or bowing inward, which is common. 85% of the population have pronated feet. So I just hope that this gives you a little bit of an understanding of two very basic problems: tendonitis of the elbow and a tendonitis plantar fasciitis of the foot. Both of these things can be dealt with very effectively with non-invasive, non-chemical, and obviously non-surgical procedures. I hope you found that helpful.